Okay, what about Prilosec? What's the deal? Well, there's hot new research on it. 3 new complications have been identified with Prilosec. And so it goes back to, first of all, what about the MGB? Well, the MGB is wonderful. Okay, we can shut off the video now. But we would say the MGB is very good, but it's not perfect. In other words, a minute ago you were talking about Disneyland. You know, we're not in Disneyland. It's not Fantasyland. A perfect surgery, everything good, nothing bad. All benefits, no risks. MGB is not like that. The MGB has 1 or 2 very common risks. And risk number 1, to my way of thinking, is ulcers or gastritis or upset stomach that happens right at the connection between the stomach and the bowel. And it's called a marginal ulcer. Okay? If you take a baby aspirin every day, you know, a lot of people take a baby aspirin to protect from heart attack. About 5% of people every year, in many studies, will have GI bleeding at gastritis or an ulcer. Okay? The MGB, about 5% of people, just like a baby aspirin, are going to have GI bleeding or an ulcer every year. Okay. Now, if we know that, first of all, we need to tell our patients. Okay? Because there are other things they could avoid, like if you have the MGB, don't take an aspirin. Don't take Motrin. Things like that, because they cause ulcers. And alcohol and cigarettes and coffee and soda pop, we also think are bad choices, because they may irritate the lining of the stomach and set you up to get that bleeding ulcer complication, which I can tell you like a friend, you do not want. You don't want that. We also know there's some protective things you can do. There's some protective things you can do. You can eat some yogurt. You can take some Tums, which are antacids. And you could take Prilosec. And now the question arises, if there's a 5% risk of getting an ulcer, should we have 100% of people take Prilosec forever? Well, we have 100% of people wear seatbelts, and most of us are not going to get in car crashes, but there's very little risk from the seatbelt. We used to think that Prilosec was essentially risk-free. And in fact, it's one of the most commonly prescribed classes of drugs in the world. People prescribe these drugs left and right, and they prescribe it for people with reflux, and they prescribe it for a lifetime. So there are lots of doctors who think that taking Prilosec forever is okay. On the other hand, there's now some research showing if you take Prilosec for a long time, it might decrease the effectiveness of a heart medicine called Plavix. If you take Prilosec for a long time, it might increase the risk a little bit of getting osteoporosis, because you change the pH of the stomach and you don't absorb as much calcium. There may be an increased risk in a really scary, serious infection called Clostridia difficile, which is a rare bacterial diarrhea. And so because of that, I think that we should think about the Prilosec like we think about any medicine. You don't want to take it if you don't have to. I think a couple of years after the surgery may be a good idea. I think I would do the protective things. I would stay away from the bad things. And I would try to not take the Prilosec. If you are bothered and you feel burning or irritation or upset stomach, offer the Prilosec. Instead of just taking it for a lifetime, call me, come and see me in clinic, and let's fix that little ulcer by high-dose therapy for a short term as opposed to a lifetime of Prilosec. So again, this is kind of new. How long should you take Prilosec after the MGB? 6 months, a year or two maybe, but a lifetime may not be a good idea because there are some risks to that. And I'm not sure, even though ulcers are a big problem for us, it's still only 5%, which means probably at least maybe around 95% of people don't need it forever. And now that we know that it has some complications, we're kind of dialing back our recommendations on lifetime of Prilosec. So good question.